Hi, my name is Holly Perli. I am a registered nurse at Monument Health. I work in the Nursing Professional Development Department, which means I help to onboard and educate new nurses who come to the organization. I'm the liaison to college students who are in the nursing program at the moment as we support them through their clinicals. And then I also support the departments within Monument Health with things like annual yearly competencies, new education that comes out, evidence-based practice, and things like that. So to become a registered nurse in the state of South Dakota, there are both 2-year and 4-year college programs. The bachelor's degree tends to be the gold standard for professional practice, but there are still 2-year associate degree programs which allow for students, especially right out of high school, to get into a nursing major and finish school a little bit sooner. Both associate degree and bachelor's degree nurses work in hospitals and clinic settings. The college education needed, most programs will start with general education courses and then 2 years of freshman and sophomore year of general education courses usually, and then as juniors and seniors move into a nursing program, which is the specifics of nursing. So assessment skills, pathophysiology, pharmacology that talks about medications and how they work, which then lead to the degree completion. As a registered nurse, you can work just about anywhere doing anything, taking care of any kind of patients that you prefer. So, of course, cardiac patients with heart troubles, oncology is cancer patients, orthopedics where folks have bones and joints fixed, that kind of thing, as well as in clinics. And then beyond that, there's even more to do past taking care of patients. So there are leaders in administrative and leadership roles who help to guide and grow other nurses. Folks like myself who help to educate nurses and grow them professionally in their role. Also advanced practice nurses who act like providers and can see patients independently and prescribe medications. In the operating room, CRNAs, certified registered nurse anesthetists, help put patients to sleep and keep them safe during surgery. So there's just so much to do with a nursing degree, whether you're interested in being at the bedside forever or moving on to some other kind of role. You know, I chose nursing because as a young adult, when I was 22, I had my first daughter and had been lucky to be a healthy person up until that point and never really needed much medical care except for routine checkups and things like that. And I was just really impressed at the care I was given and my daughter at that time. And it really kind of inspired me. I had a college degree in secondary education, teaching high school science at that time, and thought, I'm going to go into nursing. And so I did. I was lucky to have a foot in the door with all the science classes I had already taken and was able to just jump into a nursing program. But I feel like every nurse has that why story about what led them to the profession and to the career. And they're just about always about helping people and serving others. And that's what you get to do as a nurse in just about any role you can pick. So as a nurse, I've worked in 4 different roles. As a new graduate RN, I started on a transplant unit. So that was solid organ transplant, taking care of people who were either waiting or had just had a kidney, liver, pancreas transplant. And then I moved into an intensive care role here at Monument Health, and then now in nursing professional development. Before that, though, I always like to say that real-world experience or healthcare experience isn't always necessary in pursuing a healthcare career, although it helps. But I think it's important for you to know that as you start looking for jobs or working as a young person, there's a lot of relevant experience that isn't necessarily healthcare. So if you think of things like lifeguarding or bussing tables or working in a daycare and things like that where you have to learn how to deal with people and customers and meet other people's needs, I think there are a lot of ways to call work relevant that isn't necessarily in healthcare. But that being said, at age 18 in the state of South Dakota and at Monument Health, you could join our team as for example, a patient care champion, a nurse aide, or lab tech, or something like that, where you can really get your foot in the door with a healthcare organization and see what we all do and start to familiarize yourself with different roles. Yeah, I would pick nursing as a career if I had it to do all over again. I would probably start sooner. Like I said, had a college degree in something else first, and then my Bachelor of Science in Nursing was my second degree. So I wish I had a little bit more clarity and a little bit more opportunity as a even middle schooler or high schooler to familiarize myself with the industry or with the career at all. And I probably would have chosen nursing sooner, but looking back now, I absolutely would pick this career again. I've learned a lot of things being a nurse. I think starting out, we all assume that we're going to be able to help people and provide care to others in some of the most important times of their lives, and that is very true. Some things that I've learned, though, is that it's not just taking care of the patient. There are family members usually around as well, and so who we actually take care of is sometimes a whole unit or a whole community or a whole type of patient population. And so you really can find ownership in whatever specialty it is that you kind of go into as a nurse, where it's larger than just the person in front of you. Another thing I've learned too is that there's always something new to try. So if you start in one field, maybe you fall in love with it, maybe you don't like it so much, there's always another avenue still within the career path of nursing to serve others. That could be working from 8 to 5 behind a desk, that could be teaching, that could be still at the chair side or bedside. So the opportunity just abounds within the career field, and that's not always something, it's not something I thought of when I first got started. In my role, I'm lucky to facilitate our Student Nurse Extern program, which is a summertime internship for seniors in college to be. So they have 1 year left of school, and it's a clinical opportunity in which you can come and act like a nurse, working side by side with an RN all summer and get some more clinical experience. And so in that role, I get to look at applications and hire college students for this summertime experience. And some of the things I look for are flexibility and willingness to change, knowing that our roles and our jobs are not static and they're not going to stay the same. Also a personality that allows for growth and constructive feedback, someone who will ask questions and not pretend like they know it all or are unwilling to ask questions, because when we are dealing with life and death patients, sometimes it's not safe to pretend like you know it all when you don't. So it's really important to be a good communicator and be able to develop relationships with people who can help you grow and be willing to do that. Other than that, I mean, we of course will look for clinical skill and experience and some of those kinds of things with the clinical experiences that these college kids have had, but also knowing that we can teach you just about any kind of skill, any kind of tube or line or drain or pump or whatever, we can teach you how to use that. But the soft skills and dealing with people and being compassionate and patient and those kinds of things are harder to teach and they're harder to learn. So an applicant who comes to the table with those kinds of things already gets an extra look from me.